Welcome to the Health ABC series. This presentation will cover mammograms. In this talk, we will cover why we get mammograms, how mammograms work, what to expect at your mammogram, and how to interpret your mammogram results. But first, our disclosure statement. This talk was created by medical students solely for the purpose of patient education. It is not to be used as medical advice and does not replace seeing your doctor. Why do we get mammograms? There are two main reasons people get mammograms. Typically, women ages 40 and above get screening mammograms every 1 to 2 years, depending on your age, risk factors such as family history of breast or ovarian cancer, and your personal health history. There are different screening recommendations from different organizations. The ones listed here on the screen are from the American Cancer Society. Talk to your doctor about your risk for breast cancer and which screening protocol they recommend. People getting screening mammograms feel fine and have no symptoms of breast cancer. The purpose of the screening test is to detect cancer that is too small to see or feel on a breast exam. The smaller the tumors are when we catch them, the better chance we have to treat and even cure the cancer. People can also get diagnostic mammograms, which means that these people have some kind of symptom, such as a new lump, changes in the skin of the breast, nipple discharge, or other changes that you may have noticed. A mammogram is a special type of X-ray that is used to look at the breast tissue. The X-rays used have less energy and radiation than normal X-rays. This makes them safe to use as a screening test. The X-rays work by shining invisible light rays through your body. When you have a really strong, powerful light, like a lighthouse or car headlights, you can see things from very far away. But with a weaker flashlight, you have to be a lot closer to be able to see anything. Since the amount of radiation used in a mammogram is less, the breast tissue is placed between two plates to get a closer, clearer image. X-rays work by having objects like bone or water absorb the energy that passes through them. Things that absorb the most energy are more dense, like bone and metal, while things that are less dense, like fluid and air, appear gray or black. There is a wide variety of types of tissue, but typically tumors are more dense and appear more white, like bone or metal. The mammogram can pick up small areas of dense tissue that you cannot feel with your hands. Your mammogram, in some ways, is like your fingerprint. All breasts are different. Your breast tissue will have a normal pattern depending on how fatty or dense the breast tissue is. This can change naturally over time, but certain changes may look more concerning than others. This is why it is important to get a screening mammogram even before a potential cancer can develop. The radiologist needs to have a beginning mammogram, your personal fingerprint, in order to compare and see how things are changing over time. When you go to get your mammogram, you will be asked to undress from the waist up. The breast is placed between two plates in order to take the X-ray. The plates come together and compress the breast tissue in order to flatten the breast to get a clear image. In a regular 2D mammogram, two pictures are taken of each breast. This compression is uncomfortable, but lasts only for a few moments while they take the picture. Some women have more tender breasts in the week before their period and during their period, so some women prefer to schedule their mammograms to avoid these times of the month. On the day of the mammogram, you should avoid deodorants, perfumes, and powders around your chest, head, and neck, as they can sometimes interfere with the image. You got your mammogram, and a few days later, you now have your results. Great, but what do they mean? Only about 10% of women who get a mammogram are asked to return for additional testing. This number is a little bit higher for your first mammogram because the radiologist doesn't have a baseline. Remember when we talked about your breast having a fingerprint. Sometimes the radiologist can't tell if there's something suspicious or if it's just your normal breast tissue. The way to tell the difference is either by watching it closely to see if it changes or to do an additional test. Even better, only 2% of women who get a mammogram need a needle biopsy. The way your mammogram is graded is called the Birad Score. It can be a little confusing at first. The most confusing are scores of 0 and a score of 2. A score of 0 is said to be incomplete. Yes, you got through the exam just fine, but the image they got was not good enough to see the tissue well. Here you will be asked to either repeat the test or to take a different test, such as an ultrasound or an MRI, which may be better for your breast tissue. A score of 1 is completely normal, but you should still keep up with your regular screening. A score of 2 is not necessarily any worse than a score of 1. It's not normal, but it's also not cancer. Some things that can cause a score of 2 are benign masses called fibroadenomas, inflamed lymph nodes, or calcified blood vessels that are found in the breast. These scores can also keep getting normally screened. A score of 3, 4, or 5 becomes increasingly concerning and will require closer follow-up and possibly a biopsy. Still, most of these are not cancer. You will not get a score of 6 unless you have already known that you have breast cancer. This score is used to monitor people who are receiving treatment for breast cancer to see if the treatment is working. Another note that you may see on your mammogram report is a category rating for your breast density, which is on a scale from 1 to 4. As we have seen before, different women have different densities of breast. All can be completely normal, but it is good for the radiologist to know in case you need closer follow-up or a different test to best evaluate your breasts. 1 is the most fatty and least dense, and 4 is the least fatty and most dense tissue. Remember, these tests are not perfect and may miss some things, but that is why it is so important to keep up with your annual screening, no matter what your results are. Keeping up with mammogram screening has been able to reduce deaths from breast cancer by 40% since the 1980s. Thank you for listening to this presentation. Here are a few resources in case you want to know more about mammograms. As always, talk to your doctor about what screening tools are right for you.